Thank you. I was talking to a young relative the other day, and he asked me, is anyone listening? Well, I could have invited him to hear Carol's introduction, but I thought I would start what I talked to you about with my response to my young relative's question. Is anyone listening? After all, I published my first paper on the social breeding. Is this working? Yeah. I published my first paper on the social
Is it? He needs to just flip it on. You go up there. You just need to flip it on.
So I can walk around. Published my first paper on the social grading of health 40 years ago, 1978. And recently, I wrote a book, the first line of which, largely aimed at doctors and healthcare people. The book wasn't, the first line was, which was why treat people and send them back to the conditions that make them sick. We need to address the conditions that make people sick. And so this first bit is a bit of indulgence in responding to my young relative's question. Is anyone listening? The Italian translation of my book, only the Italians will have me on the cover. La salute disuguale, unequal health. And the Trento Festival of Economics, Trento in North Italy, had as its theme, not last summer, the summer before, unequal health, la salute disuguale. And I was invited to speak, and I arrived in Trento, and I'd quite forgotten that that was the theme. And I saw these signs everywhere saying salute disuguale, and a cardboard cutout for me. So I had to have a photo taken with the cardboard cutout. And I SMS'd it, what you call it, texted it, how people say that, to my children. And one of them came back and said, I think the cutout looks better than the original. That's why you have children. Now, wait for this next bit. I don't know if I can put this on my CV. A crossword in La Repubblica, the Italian journal. 146 down.
Can you find Teresa and Frank Teresa knows. He's got the red shirt. He was just doing the food.
Google Scholar. There it is. And somebody texted this forever. And the Korean translation of the Japanese translation, the Korean translation. We've been very concerned globally, but particularly in the UK, at monitoring what's been happening to health inequalities and the social determinants of time. As I'll show you in a few moments, I produced a report in Britain, so-called Marmot review in 2010 about what we could do to address health inequalities. And we've been monitoring. And last year,
that was Frank.
Last summer, we produced this. This is life expectancy in England, 2006 to 2014. So
no,
in 2006 to 2010, life expectancy increased for women, 0.24 of the year every year.
So I'm like, I can't leave.
The men was 0.3 of the year. In fact, that 2006 to 2010 has gone on since the end of the First World War. From 1921 to 2011, it's been about 1 year every 4 years. 6 hours every 24 hours. You spend 6 hours of this colloquium today, you get it for nothing. Because at the end of it, your life expectancy is as long as it was at the beginning. So you get all that for nothing. And that's gone on for 90 years. That's just astonishing. And then, in 2011, it stopped. Now, you're not going to believe what I tell you next. I am not, at least in public, party political. The fact that a Conservative-led coalition government was elected here is a fact, not an interpretation. So when we published this, the BBC got all excited, and I was on the media television. I had a busy day, and I'm getting towards the end of this day, and our Minister of Health, the Secretary of State for Health, Government Minister, tweeted, "Respect Marmot." Yeah, it didn't have punctuation, so I didn't know if there was a question mark. Respect Marmot? Respect Marmot. But since he was on the BBC this morning, life expectancy for men has increased by 61 minutes. So I tweeted back, "What are you saying? That the Office for National Statistics got its figures wrong?" Question mark. If ONS got it right, let's discuss. One of my colleagues tweeted, "Ooh, the Secretary of State has picked a fight with Marmot about statistics." My money's on Marmot. And I don't know if I should tell you this, but I can't go through this, so I'll do. So at the end of this rather busy day, there's a body in the UK called the Royal Society of Medicine, and they were giving me their gold medal, so I had to turn up in black tie the whole year. In fact, my last interview with the BBC, I couldn't figure out how to do this, so I turned up wearing a tuxedo for a radio interview. They said we stopped doing that around 1940. And I was walking from my university to the BBC, and I was really embarrassed for walking in a black tie at 4:30 in the afternoon. Nobody gave me a second glance. In London doing something like that, there's so many crazies around. So I get off to the Royal Society, and the President's making his speech. They were giving his gold medal. He departed from his speech, and he said, "I never thought I'd say this. I feel sorry for the Minister of Health." Well, so I was asked, is this austerity? Could it have caused that? And I said that the adult component of social care spending went down by 6% from 2009-10, at a time when the population over 65 grew by 1/6. So the per capita spending on adult social care, particularly for older people, declined. Health service expenditure on our NHS did not rise in line with inflation. In fact, the per capita spending was due to go down. And reductions in adult social care spending and healthcare spending will have an impact on the quality of life of older people. Whether it affected the length of life of older people, I don't know, but it's urgent to try and find out. And the BBC said, "Yeah, but did austerity kill people?" I went through all this again, and a bit later the interviewer said, "Yeah, but did austerity kill?" And I said, "One of your colleagues told me, if a journalist asks you the same question 3 times, just keep giving the same answer." And he smiled and just saying that. Well, you can see why the government was trying to say this couldn't have happened. Somebody wrote a piece in the Sunday Times of London, about me, full-page thing saying professors should be more careful before they shoot their mouths off. Don't blame Tory cuts. Well, I didn't. I said it was urgent to investigate if cuts in social spending could be responsible. And the person who wrote this thought it could have been the flu, or it could have been a bad winter, or it could have been obesity, or it could have been an artifact. It could have been anything but austerity. And I wrote a piece and said, I'm surprised by his certainty. I expressed no such certainty, but I thought it was important to try and figure it out. And the second question I got asked, maybe we just reached peak life expectancy. It's got to slow down sometime, hasn't it? Well, that's a reasonable question. And if we look across Europe, life expectancy 2006 to 2010, this is females, and then 2011 to 2015, and you can see that there was a slowdown in most countries. But there's Germany and the UK. We're the worst. Now, that is consistent with saying the global financial crisis, 2008, and policies of austerity right across Europe may have had an adverse impact on life expectancy. But one needs to be a bit careful about jumping to conclusions. There's Greece, big slowdown. But why does Greece look better than Germany? So be careful, I told myself. Don't jump to conclusions. We need to look at the question of austerity and cuts in social spending, but don't jump to conclusions. And it relates to the question of, can government policy make a difference to health inequalities? I've already said I'm not party political and you don't believe this. So the new Labour government in Britain, which was elected in 1997, did have a strategy to reduce health inequalities. It was an explicit policy. Is there any evidence that it worked? Is there any evidence that it worked? What these researchers did was look at the difference in life expectancy between the poorest 20% of local authorities and the rest. The difference between the poorest 20% of local authorities and the rest. And before the strategy, in the period 1983 to 2003, the difference between the poorest 20% and the rest was increasing by 0.6 of a month for men, a bit less for women each year. During the strategy, the gap got smaller. Health inequalities diminished. The government had an explicit policy to reduce health inequalities, and health inequalities got smaller. Correlation does not equal causation. But it's kind of what we wanted to see if the policies might have been on the right track. It's consistent with something good happening. Then we got a Conservative-led coalition government. They scrapped all that stuff, and life expectancy gap increased again. So it's consistent with saying that government policy can make a difference to reduce health inequalities. One of the things that I said was, this slowdown in Britain is a warning sign. We don't want to go this way. This is US life expectancy, declined 2 years in a row, I think now 3 years. The biggest increase, unintentional injuries. We just heard a presentation about trauma and anesthetics. Unintentional injuries, and unintentional injuries include accidental drug overdose. 63,600. You have to forgive me. I don't understand the debate in the United States. There's lots of things about the US I don't understand. I was here once, and 2 New York baseball teams were playing each other and you called it the World Series. Added to these 63,600 deaths, there are 32,000 from firearms. Why on earth you persist in killing yourselves and each other with guns is beyond me and every other European. We just simply can't understand. That's 100,000 deaths that shouldn't occur from drugs and guns. What on earth are you doing? Many of you will be familiar with this. Anne Case and Angus Eden looked at mortality in men and women aged 45 to 54 from 1990 to 2012. They've since updated it. And mortality was coming down in France, Germany, UK, Canada, Australia, Sweden. Big differences between France and Sweden, but coming down in all these countries, as it had been in US Hispanics, and there is US non-Hispanic whites. And they called it deaths of despair. Number one, poisonings due to drugs and alcohol. Number two, suicide. Number three, alcoholic liver disease. These are not medical care issues. Well, the drug overdoses to some extent bad behavior from medical care. But these are not problems you solve with better medical care. These are societal problems. And at older age, this is life expectancy at age 50 for men. So people who were born in 1920 will be 50 in 1970. People who were born in 1950 will be 50 in 2000. So it's life expectancy at age 50 by deciles of income. So the poorest 10% barely increased. Next 10% increased more. So the social gradient is in evidence, and the gap is increasing. The gradient is getting steeper. Now you've had a bit of nutrition. You're feeling strong. You're ready to cope with what I'm going to show you next. That's men. This is women. Oh my God. Declining for the bottom 10%. Declining for the next 10%. Declining for the next 10%. The bottom 30% of the income distribution life expectancy is going down for women at age 50. And the inequalities are getting dramatically bigger. This is a crisis. And of course it is related to social and economic inequalities in society. I'm going to skip over that from my English longitudinal study of aging. It's to deal with issues like this that we had the World Health Organization Commission on Social Determinants of Health. I chaired that commission. We published our report in 2008, and we called the report Closing the Gap in a Generation. We put at the heart of what we were trying to achieve empowerment. And I thought of empowerment in three ways. Material. If you don't have enough money to feed your children, you can't be empowered. Psychosocial. Having control over your life. We were talking about eudaimonic well-being, which includes control over your life. And political, having voice. We said in the report that a toxic combination of unfair economic arrangements, poor social policies and programs, and bad governance is responsible for most of the inequalities in health that we see. And we talk about social determinants of health as the conditions in which people are born, grow, live, work, and age, and inequities in power, money, and resources, which give rise to those inequities in the conditions of daily life. We said on the cover of a WHO report, social injustice is killing on a grand scale. Because it was a WHO report, I thought I should pull my punches a bit. Social injustice is killing on a grand scale. I mentioned the Marmot review in England. I was asked by the Prime Minister then, Gordon Brown, how could we translate the findings and recommendations from your global report for one country, England? And I called my report Fair Society, Healthy Lives. If we put fairness at the heart of all policy making, health will improve and health inequalities will diminish. And then I was asked by the World Health Organization European region to do a report of social determinants and the health divide, the East-West health divide in the WHO region. And we, last month, published the executive summary that Carol Ruth mentioned of the PAHO Commission of Equity and Health Inequalities in the Americas. And we called it Just Societies, Health Equity and Dignified Lives. In my English review, the others not terribly different, I had 6 domains of recommendations. Give every child the best start in life. Education and lifelong learning. Employment and working conditions. The 4th one, really radical for a rich country. Everybody should have the minimum necessary to lead a healthy life. I should have done that, but I won't. We calculated recently, in England, if people in the bottom 10% of the income distribution followed the healthy eating guidelines, they would spend 70% of the household income on food. Do you know what the cost of housing in London is? If you spent 70% of your household income on food, you wouldn't have a house. Or you could pay the rent and not eat healthily. Or you could choose to eat and not heat, sit in the cold and eat your canned spaghetti. So we think everybody should have enough money to live on. What a radical idea. The 5th, healthy and sustainable places in which to live and work. And the 6th is what I call taking a social determinants approach to prevention. You don't just tell people not to smoke. You deal with the determinants of healthy eating and smoking and the like. This is really odd. This is, I can't explain or defend this. I spent a year as president of the World Medical Association. This is really odd. This is an association of doctors. You know, we talk to each other about how much they get paid and things like that. And I spent my whole life saying that the key determinants of health are outside the healthcare system. It's not what doctors do for patients, it's the key determinant of health. And now I'm president of the world's doctors freely. So I pursued the hypothesis that I could get doctors interested in health. And I thought, I'm on a roll here. Maybe I could get them interested in health inequalities. And maybe I could get them interested then in the conditions which make people sick, the social determinants of health. And I said my 2 messages in a world of post-fact politics. What could I be referring to? In a world of post-fact politics was evidence-based policy presented in a spirit of social justice. Remember, we said on the cover of the WHO Commission report, social injustice is killing on a grand scale. I mentioned that I chaired the PAHO Commission of Equity and Health and Inequalities in the Americas. We had a meeting in Washington, D.C. And I went for a walk in the mall. You know the mall, that's that area that was sparsely populated during Donald Trump's what? Political. And I found myself in the area of the mall devoted to Martin Luther King, who you quoted this morning. And he said, I believe that unarmed truth and unconditional love. And I thought, unarmed truth? That's a better way of saying evidence-based policy, but it's the same thing. Unconditional love? Yeah. Spirit of social justice? That's kind of the same thing. Thank you, Dr. King. I believe that unarmed truth and unconditional love will have the final word in reality. This is why right, temporarily defeated, is stronger than evil triumphant. We will win this battle for social justice because we have right on our side. The world looks pretty grim at the moment. You think you have troubles, we've got Brexit. Lastly, you could be in Hungary or Poland. Lots of bad stuff going on. But we will win the battle for social justice. So, the mission of my presidency of the WMA and my life was health equity through action on the social determinants of health. And I said to the doctors, why treat people and send them back to the conditions that make them sick? The doctors at the Medical Association said, okay, we're convinced. Well, what do you want us to do? So we produced a book for Doctors for Health Equity. And we said 5 things: education and training, working with individuals and communities, the health sector as an employer, not just doctors, nurses, ambulance drivers, secretaries, lab technicians, and the like, working in partnership, and the workforce as advocates. So, an example, working with individuals and communities. We said in all of my reports, take a life course approach. Give every child the best start in life. I'm going to get some of your nice paintings to help me illustrate. Give every child the best start in life. Now, blue and red don't mean the same thing in the UK that they mean in the United States. Don't interpret it. And if you would, just focus on the blue dots for the moment. And that's not politically speaking. Let's focus on the blue dots. What we're plotting here is the percent of children age 5 who have a good level of development for each local authority in the country, classified by the level of deprivation. So we've got the least deprived to the right as you look at it, the most deprived to the left, and what you see, the more affluent the local area, the higher the proportion of children age 5 that have a good level of development. Okay, clear? One strategy to reduce inequalities in early childhood would be to reduce poverty and deprivation. Bring these up towards the middle, and you bring up the proportion of children age 5 with a good level of development. There is, as we talked about last night, scatter around the line. For a given level of deprivation, some areas are doing better than others. And that relates to the red dots. You're now allowed to look at the red dots. The red dots represent children who are eligible for free school meals. That's a means-tested benefit. So only the poorest children are eligible for free school meals. The difference between science and politics, one of the many differences between science and politics, is in science, when you get it wrong, you learn something. I confidently... Why are they laughing? I confidently predicted how this would come out, and I was 100% wrong. I thought the poor kids would do worse in the poor areas, and you talked about wanting to look at that question. I thought being poor, coming from a poor family, and being in a poor area would be a double burden. And I was 100% wrong. So I did what any scientist would do. I tried to change the facts. And I couldn't. I said, let's recode it. Let's rerun the analyses. We got something wrong. Let's do it again. And every time we did it, it came out this way. This was very painful. I had to admit, I was wrong. It happens. I was wrong. But this is really interesting. Why are the poor kids doing worse in the wealthy areas? So, I'll give you an example. 60% of pupils in England, on average, have a good level of development age 5. Children eligible for free school meals, just under 45%. The gap is below the 15%. Hackney, which is a poor part of East London, rapidly gentrifying since my daughter just moved in, but still a poor part of East London. A poor part of East London. The poor children are doing as well as the England average. Wow! The gap between the poor kids and the average in Hackney is only 4%. In Hackney, the director of education said to me, we tell ourselves every day, poverty is not destiny. We can make a difference. I caught the train to South Wales. I'm testing your geography. I caught the train to South Wales and I stopped in Bath Spa, which is a gorgeous bit of England, beautiful countryside, lovely Georgian Bath. And as the train stopped, I called out, what do you do for poor kids in Bath? And I'm not hearing voices, but I imagine them calling back, poor kids? We didn't know we had any. Aha! Maybe that's the answer. In Hackney, there's so many poor kids that if you don't focus on the poor kids, what are you doing? In Bath, you ignore them because there aren't very many, and they do really badly. This is better than rocket science. This means focusing on the problem, you can make a difference. This is terrific. Why would people want to lie when the truth is so interesting? What about reducing poverty? I said 2 strategies, break the link between poverty is not destiny, but reduce poverty. This is child poverty in the rich countries, it comes from UNICEF. And child poverty is a relative measure, is defined as less than 60% median income. So in Denmark, Iceland, Norway, Finland, Korea, child poverty is between 9 and 11%. In the UK, it's just under 20%. In the United States, it's 29%, just behind Mexico. I was giving an address a few years ago, the opening session of the American Public Health Association. 7,000 people in this barn of a place. And I showed them an earlier version of these figures. And I said, your child poverty levels are worse than Latvia. You live in a democracy, I said. This must be the level of child poverty that you want. Otherwise, you'd elect a government that did something different. And then we went and elected this orange nightmare. The real pornography is not what he did with a porn actress. It's the fact that no one's talking about child poverty. That's the real pornography. And there's a lot you can do about it. In Finland, they reduced child poverty by 2/3, reducing child poverty by social transfers, tax credits, benefits, and the like. You reduce it by 2/3. In Finland, in the United States, you choose to reduce child poverty by 18%. Trivial. Obviously, you tolerate child poverty. You think that's okay. You're damning today's children to be the people whose life expectancy is not increasing a generation from now. The other part of early child experience, of early childhood, is not do you get good nurturing, but adverse child experiences. ACEs, so-called. In England, incarceration of parents, drug abuse, sexual abuse, alcohol abuse, domestic violence, physical abuse, it's awful, mental illness, verbal abuse, parental separation. And they all follow the social gradient. The lower in the hierarchy, the more deprived, the greater the frequency of these adverse child experiences. And we've calculated the potential benefit of eliminating 4 or more adverse child experiences. So people who have 4 or more adverse child experiences, you could reduce early sex by 1/3, unintended teen pregnancy by just under 40%, smoking, binge drinking. Look at this, violence perpetration. Half the perpetrators of domestic violence have 4 or more adverse child experiences. And even more chilling, victimization. Half the victims of domestic violence had 4 or more adverse child experiences. There's a great deal we could do, and they relate to deprivation. They follow the social gradient. Wealth inequality. This got raised earlier this morning for the so-called Rich Countries Club. So 2004, all the latest figures, there's Greece, Slovakia, Japan, Italy, Poland, Belgium, the United States. Almost on a different planet.
Right.
And 2010, 2014, and the wealth inequality is just going up. You talked about income inequality this morning. The wealth inequality is even more dramatic. And this has impact on the next generation. I'll come back to income inequality. The Gini coefficient is a measure of income inequality. If Bill Gates had everything, another day, Jeff Bezos had all the money, and the rest of us had none, the Gini coefficient would be 1. So a high Gini means really weird income distribution. A low Gini means much more egalitarian. Sweden, Finland, Norway, Denmark. There's Brazil, Colombia, Chile, Argentina, and there's the USA. So look at these rich countries. And then what we've got here is a measure of how much social mobility there is. So if the income of adult children exactly resembles the income of their parents, in other words, no social mobility, rich parents, rich children, middle parents, middle children, poor parents, poor children, you'd be down here. If the income of your parents makes little difference to your own income, you'd be up here. So you know these Marxist-Leninist hellholes loved by Fox News in the land? Denmark, Norway, Finland, Sweden. You know what? They're lands of opportunity. It doesn't matter who your parents are. Your chance of getting ahead is more or less independent of your parents' income or education in the Nordic countries. And it matters enormously in the land of the free. There's much less social mobility in the United States than there is in most European countries. While I'm on the subject of money, tax havens. 50% of the wealth in tax havens belong to the top 0.01% of people in advanced economies. That wealth is equivalent to 5% of global GDP. That's how much money's just squirreled away in funny places, little islands and the like. And there's tax avoidance on a massive scale. Get rid of this tax avoidance, you could fund school teachers. You could fund early child development clinics. You could fund anything if you got rid of this. And then added to that is avoidance of tax by multinationals. So looking from Europe, 600 billion euros a year shifted to the world's tax havens. Every year, 350 billion euro to European tax havens. I went to a meeting in Luxembourg, and I was looking at everybody on the streets thinking, who are you cheating for tax? I mean, the gross national income per person in Luxembourg is $80,000. They're all tax cheats. They were probably looking at me the same way. And Starbucks pays just about no tax in the United Kingdom. And the Parliament asked them, why don't you pay tax? And they said, we don't make a profit in the UK. You mean you're selling that coffee just as a charity to the British population? Well, they're counting, they claim their coffee beans come from Luxembourg. I was in Luxembourg, I didn't see any coffee beans. I thought they came from Central America, but the accountants come from Luxembourg. So it deprives the EU of a fifth of corporate tax revenue, 60 billion euros a year. Who can do a lot with that money? Health sector is employees, working in partnership. And I want to finish with this, but I'll take a few moments if you permit me. One of the advantages of being president of the World Medical Association for a year is I made connections with doctors in a lot of countries. And I was invited by the Australian Broadcasting Commission, the Australian ABC, not the American ABC, the Australian version of the BBC, to do some radio lectures on social determinants, health equity. And the AMA, the Australian Medical Association, the Australian Medical Association wrote to me and said, we heard you're coming to do these lectures, can we help you? And I said, yeah, I would like to see doctors in action on social determinants of health. Now, in Australia, the inequality that they're very concerned about is the difference between Indigenous Australians and non-Indigenous Australians, Australian Aborigines and Torres Strait Islanders. 10.6-year gap for the men, a 9.4-year gap for women. When I arrived in Sydney, long flight from London, and the journalist said to me, we've spent billions of dollars trying to close the health gap between Indigenous and non-Indigenous Australians. What should we be doing? And I said, I just arrived. I'm jet-lagged. You spent years thinking about this. Give me 24 hours, I'll spend time. Well, the doctors took me to this Aboriginal community centre. the Tharawal Aboriginal Corporation, 50 kilometres south of Sydney. I was shown around by 2 Aboriginal women, administrators at the centre, terrific. And I was shown various parts of this centre. We went to the antenatal clinic. Aboriginal women famously don't attend antenatal clinics. So they had the belly cast program. They got women to take plaster casts of their pregnant torsos and decorate them with traditional Aboriginal art. It's lovely, absolutely lovely. And the women love it. So they come and they have educational gatherings before pregnancy, during pregnancy, after the birth of the baby. So the women love it. They're celebrating their traditional culture. And at the same time, getting advice about healthy pregnancy and handling the baby and all that good thing. Ongoing support, education, and baby checkups. On the day of my visit, I could have stayed there for days. It was just wonderful. But the day of my visit, at the time we went to the bit of the campus that was dealing with the little children, and they'd just been put down for their afternoon nap, siesta. And the young woman who was looking after them, I said, how do you know if these children are developing normally? And she took a stack of forms off the shelf with 30 indicators of cognitive development, linguistic development, emotional, social, behavioural development, one for each child. I said, where did you get these from? From the local university. They're up to the minute in measures of early child development. And the older children and the families, they all go through evaluated programs, triple P parenting, various evaluated programs to improve parenting and improve child outcomes. I found myself in the area of the campus that dealt with drugs and alcohol problems. And the woman who met me, huge Aboriginal woman, I said to her, you must have the most difficult job in this whole centre. And she said, no, I have the most rewarding job in this whole centre. And she took me over to a wall to see an Aboriginal painting. And she said, the man who did this, when he came to us, he had all the problems of drugs and alcohol and domestic violence. And we helped him put his life back together. And he did this painting as a thank you. I have the most rewarding job in this centre, she said. And they have programs for the elders, grannies against removal, leave our children with us. I met a child psychologist at the centre, and she said she was dealing with the consequences for children and their families of removing the children from the families. I said, are you talking about the stolen generation? Because there was a vogue in Australia for removing Aboriginal children from their families and trying to breed the Aboriginal out of them, grow them up white, with disastrous consequences, both for the children and the family. And this young woman said, no, no, it's still going on. Because of the problems of drugs, violence and the like, children are being removed, and it still has disastrous consequences. And then she gave me the answer to the journalist's question. She said about the health gap between Indigenous and non-Indigenous Australians. She said you can spend money, but if you've spent 200 years systematically depriving a people of their dignity and the opportunity to control their lives, if you've been disempowering, it's little surprise that simply spending money does not solve the problem. You do need to spend money, but you need to pay attention to these other things. I mentioned that the ABC asked me to give these lectures, and to trail the lectures, they had their current affairs television program, and they devoted the program to inequality. The moderator asked me to say something about income and wealth inequalities, and so I said, what do the following groups have in common? The 48 million people who make up the population of Tanzania, the 7 million people who make up the population of Paraguay, the 2 million people who make up the population of Latvia, and the 25 top earning hedge fund managers in New York. And the answer is, the previous year, each of those groups had a combined income of around $25 billion. Imagine, I said, the hedge fund managers gave up their income for 1 year. They wouldn't miss it. They're going to make $1 billion each the next year. The poor dears, what are they going to do? How are they going to deal with all that? So we'd help them, and we'd ship it off to Tanzania. You double the per capita income. And I'm not suggesting simply giving the money to individual Tanzanians, although that would not be such a bad thing to do. But imagine the clean water you could pipe to the villagers, the teachers you could employ, the healthcare workers, the clean cook stoves. But suppose the hedge fund managers said, we couldn't care less about Tanzanians. Here's an even more fanciful thought experiment. Suppose they paid 1/3 of their income in tax. I'm completely ridiculous. You and I pay 1/3 of our income in tax. But suppose they paid 1/3 of their income in tax. You could employ 90,000 New York school teachers. And one of the panel looked at me and said, you're in fantasy land, mate. You're in complete fantasy land. That's never going to happen. Lost the words. But the next day was when I went to the Tharawal Community Centre, and one of the doctors held up a sign. Let me invite you into my fantasy land, and let's dream of a fairer world.